And as the vaccine rolls out in the Commonwealth, and as that continues, there are still so many questions here as the vaccine for COVID-19 is rolled out. In this segment, Dr. Danny Avula, director of the Richmond City and Henrico County Health Departments, shares some insight with our own Evanne Armour. Here's what he had to say.
Our next guest is here to answer some important questions that you might have about the COVID-19 vaccine here in Virginia. We welcome Dr. Danny Avula here to Virginia this morning. He is leading Virginia's COVID-19 vaccination program. Good morning.
Good morning, Evan. Glad to be with you.
Thanks for being here with us. Now, I want to start by talking about some numbers. So right now, how many doses of the vaccine is Virginia getting each week, and how many are we administering at this point?
So right now we're receiving about 120,000 doses a week for the entire state, which means that, as you split that out throughout the Commonwealth by population, that every community is getting a few thousand doses a week. Now, our efficiency to administer that has been remarkably good. We, in terms of percent doses administered, we're about 15th in the country right now. And if you look at the percent of first doses administered, we're over 80%. So almost, every dose that comes in over the course of the week is going out as soon as it comes in.
Who are we focusing on at this point right now? Who are the people who are actually getting these vaccinations here in Virginia at this point?
So the entire state is in what's called Phase 1B. Phase 1A was really focused on healthcare workers and those residents and staff of nursing homes and assisted living facilities. Phase 1B has opened up to individuals who are 65 and over, have severe underlying conditions, or work in one of the essential work groups that really are kind of core to our society functioning. You think about policemen and firemen, people who work in correctional facilities or homeless shelters, teachers, childcare workers, and people who really work in the transportation and grocery industry, the things that we need to happen every day. So what's happening is the vaccine that comes into each community, about 50% of that vaccine is being prioritized for individuals who are 65 and older, and the other 50% are systematically being worked through those essential worker tiers. And I think the important thing to realize is that given the limited supply that we're receiving right now, it is going to take a while to work through 1B. Unless we see a drastic increase in supply, it's going to be several weeks, if not 2 to 3 months, until we get through that tier.
Who is going to be the next focus after that? Once we successfully meet that, we get through that, where do we go from there?
So beyond 1B opens up to our Phase 1C, and then there are other segments of society, folks who work in finance, as an example, or work in the manufacturing industries, or there's a few other categories around 1C. If you go to the VDH website, vdh.virginia.gov, and click on the COVID-19 tab, it clearly outlines who is in 1C, so that anybody who isn't currently eligible for 1B can look ahead and figure out where they fit.
What's your best advice for someone who is watching this? Maybe they don't fit into one of those categories that we're talking about right now. What can they be doing right now to help protect themselves?
Well, we have known, through the entirety of this pandemic that there are some core things that actually, that work better than anything to stop the spread of disease: to wear a mask, to maintain your distance, to stay home when you're sick, and to wash your hands. And so, I know people are tired of hearing that same thing over and over the last 10 months, but we know that it works. And so we ask that as this vaccination rolls out, that people continue to do those core behaviors to stem the spread of disease.
Dr. Danny Avula, we really appreciate you taking some time this morning to talk with us and let us know where things stand with our COVID-19 vaccination program.
Thanks, Evan. Take care.